Hello, welcome. I will be giving a presentation in Trauma and Resilience and Immigrant Children. My name is Stephanie Dubois. In the abstract, immigrant children around the world face a range of traumatic experience due to displacement, acute relation stress, and family separation. These experiences have the potential to significantly impair psychological development, emotional stability, and academic success. Displacement often involves loss of home, community, and safety, leading to chronic stress responses. Accumulation stress, including language barrier, cultural conflicts, and discrimination, compound these effects, particularly in school and various relationships. Family separations, whether due to immigrant policy, deportations, or voluntary migrations, can disrupt attachment, security, and identity formation. However, not all children respond to adversity in the same way. Many immigrant students display remarkable resilience, supported by factors such as community cohesion, access to traumatic informed care, school-based interventions, and the development of bicultural identities. These papers explore the psychological traumatic immigrant children face and identity resilience building mechanisms that support recovery and long-term adaptations. By understanding both the risk factor and the protective mechanism, practitioners, educators, and policymakers can better serve the needs to immigrant populations and promote healthier outcomes across multiple domains of development. Introduction: Immigrant children are among the most vulnerable population in the world today, facing a host of psychosocial stressors as they navigate the complex process of migration. Often fleeing war, violence, poverty, or political instability, these children are subjected to profound psychological challenges. The migration process exposes them to trauma before, during, and after relocation. In particular, displacements from similar environments, distress of cultural adaptations, and the emotional toll of family separations can leave lasting effects on their psychological development. Yet many immigrant children also demonstrate striking resilience supported by a range of individual and environmental protective factors. This essay explores the psychological trauma experienced by immigrant children, focusing on the impact of displacement, acculturation stress, and family separation. It also examines the resilience factor and coping mechanisms that can foster recovery and healthy development. Understanding these dynamics is essential for educators, mental health professionals, and policymakers seeking to support the mental health and well-being of immigrant youth. Section 1: Psychological trauma from displacement. Displacement represents one of the first and most profound distributions in an immigrant child's life, often triggered by external factors such as armed conflict, political persecution, or environmental disasters. Displacement results in the loss of home, social network, and a sense of safety. According to Fraz, Reed, Paterberg, and Stein, 2012, displaced children often show higher level of anxiety, depression, and post-traumatic stress symptoms compared to non-displaced peers. These effects are exacerbated by uncertainty and the lack of stability housing, which undermines a child's basic needs for predictability and security. Migration's journey may also involve exposure to additional traumatic experiences, including detention, human trafficking, or physical harm. A study by Suzette Orozco, Tortorora, and Louis, 2002, found that undocumented children often experience multiple traumas during their journey, including hunger, violence, and fear of apprehensions. These adverse experiences can compromise emotional regulation and impair social development. From a developmental perspective, displacement interrupts a child's attachment to similar people and environments, potentially leading to increased vulnerability to mental health disorder. The distribution of school attendance, play routine, and community supports network deprives children of protective development context for the compounding trauma. Section 2: Acculturation stress. Acculturation stress refers to the psychological impact of adapting to a new cultural environment, which immigrants' children frequently experience in their new countries of residence. This stress emerges from the struggle to reconcile differing values, language, and expectations between their heritage, culture, and the host culture. Children are often expected to learn a new language, adhere to different social norms, and succeed academically, all while managing the emotional burden of cultural displacement. Berry, 2006, identify four acculturation strategies: assimilation, integration, separation, and margination. Immigrant children who inherit maintaining their heritage culture while adapting to the host culture typically exhibit between mental health outcomes. However, those who feel merged or rejected by either culture often experience higher level of psychological distress, including feeling of alienation and identity confusion. Language barrier can further isolate immigrant children from their peers and teachers, affecting academic performance and social belonging. According to Pakocinek and Pereira, 2010, limited English profanity is associated with elevated internalizing system of particularly depression and anxiety. Discrimination and xenophobia also contributes to a cultural stress. Immigrant children who experience radical and ethnic discrimination are more likely to report lower self-esteem and greater psychological disorder. Schools are both a source of stress and a potential site for resilience building. When schools foster culturally responsive environments and support bilingual education, immigrant children are more likely to thrive. Teachers and counselors play a pivotal role in helping children navigate culture difference and a building bicultural identity. Section 3. Family separation and attachment distribution. Family separation is another major contributor to trauma in immigrant children, whether due to deportation, voluntary separations during migration, or restrictive immigration policies. Separations from primary caregiver distributes critical attachment bond. Foley, 1982 attachment theory emphasizes the centrality of caregiver-child relationship in establishing emotional security. Prolonged or sudden separation undermines this foundation and can result in long-term emotional dysregulation, behavioral problem, and trust issues. The trauma of separation is well documented among children in migration, detention center, or foster care. Research by Luke and Terrazzo, 2015, describe how separation often results in grief, fear, guilt, and helplessness. Some children's internalized experience blaming themselves for the separation or for family decisions, which can lead to depressive symptoms. Even after reunification, children may struggle to reestablish attachment relationships. Prolonged separation may alter family dynamic, especially if the child has bonded with other caregiver in the meantime. According to Rod Flores, etc., 2017, U.S. born children of detained or deported parents display significantly higher level of PTSD and anxiety than those without such experience. Policy that separates family at the border or delay reunifications exacerbates trauma and undermining children's mental health. Advocacies for trauma informs immigration's policy that prioritizes family unity. Unity is crucial in mitigating harm.
Section 4 Resilience Factor and Coping Mechanism. Despite the challenge they face, many immigrants' children demonstrate resilience, defined as the ability to adapt and thrive despite adversity. Resilience is not a fixed trait, but a dynamic process influenced by individual relations and systematic factor. Protective factors such as secure attachment, supportive community environment, and cultural responsive education system can buffer the impact of trauma. Strong parents-child relationship, even if maintained through long-distance communication, can serve as powerful source of emotional support. Ginsberg, etc., 2014, notes that children with strong familial bond are better able to regulate stress and maintain hope in difficult circumstances. In cases where caregivers are unavailable, connections with extended family, mentors, or peers can also promote resilience. Community-level support such as immigrant resource centers, after-school program, and cultural sensitive mental health service create protective environments that foster coping. For example, participation in ethical community organization allows children to affirm their cultural identity and build peer networks. Schools are crucial in shaping resilience outcome programs that promote bilingual social emotional learning and trauma-influenced practice can improve academic performance and psychological well-being. A study by Garcia, Cole, etc., 2009, found that immigrant students in supportive school environment reports higher level of motivations, engagement, and self-esteem. Spirituality and
cultural transitions may also serve as coping mechanism. Cultural rituals, storytelling, and religious practice can offer a sense of continuity, belonging, and meaning. These practice helps children retaliate their experience in empowering ways and reinforce a positive sense of identity. Section 5. Implication for practice and policy. Addressing the trauma experienced by migrant children requires systematic and culturally informed approaches. Mental health service should be trauma informed and accessible to immigrants' family, regardless of legal status. Culturally competent clinic clinicus can help children process trauma and build coping skills in ways that respects their cultural backgrounds. Schools should provide professional development on cultural sensitivities and trauma-informed care for teachers, counselors, and administrators. Policies that promote inclusion, bilingual education, and anti-discrimination effects are essential to supporting migrant students. Federal and local governments must also recognize the psychological damage caused by family separations policy and prioritize reunifications and family-centered practice. Finally, researchers and practitioners must include migrants' voices in their work. Community-based participatory research can help shape more relevant interventions and empower families as agents of their own resilience.
So, question of the day: do you feel like immigrant families should have a voice into what the government is working on? Do you feel that immigrant children should be forced separated? Why or why not? What should we as teacher, counselor, or caregiver do to make sure that children who are going through a tough time do? Do you think it's fair what the government is doing, having to force separate families and put child in foster care? And of course, these are my reference pages. Thank you so much for hearing my presentation. Hope you enjoyed it.